Good morning, ladies and gentlemen. My name is Dr. Mary Wall, and I'm here as president of the Ohio State Medical Association. A couple of years, Governor John Kasich shined a bright light on the problem of opioid and prescription drug abuse. It was a severe problem resulting in a number of deaths each day of young Ohioans often. Revealed to everyone that there was a problem that we all needed to get together and tackle. This recognition was really a clearing call to action. Governor Kasich wanted everyone in our communities to participate: physicians, police officers, teachers, business owners, all of us. It's going to take all of us to solve this problem. This program, SmartRx, is not the first blush and not the first attempt at trying to solve this problem. But what it does represent is the first time that physicians have gotten together as a group to try to tackle a huge public health problem in recent memory. And also it represents a new era of cooperation with other non-physician groups in attempting to solve a public health problem. It's a serious problem. It's going to take a long time to solve. It took us over a generation to get here. It's going to take us a long time to get out, but we have to start, we have to be patient, and we have to be collaborative and cooperative in this venture. Now, one thing that the SmartRx program that the Ohio State Medical Association has developed has done is that it has encouraged and asked physicians to step up to the plate to recognize that when we write out prescriptions for controlled substances and opioids, that we have an integral responsibility in that equation. We have a responsibility to know what the safe measures of prescribing are. We have a responsibility to do a risk assessment on our patients, to know what patients are at higher risk to develop dependency on these drugs. We have a responsibility to educate our patients about what pain is reasonable and how to treat pain, and there are alternatives to opioids and prescription medications. That's a big piece. And there has to be a commitment to physicians to seek alternatives rather than writing out a prescription merely for pills, alternative treatments for pain. Pain is a serious problem. Our population is aging. We have a lot of arthritis and chronic pain problems and a lot of malignancy in our population. That has to be dealt with. But there are other ways than just writing out a prescription for opioids that can be entertained. But in order for those to be successful, serious discussions and skilled discussions need to be entertained with those patients. We have to be the patient's advocates. And the Ohio State Medical Association a couple of years ago did a deep diving of our values and mission, and we had said that why are we here? We're here to help our patients, and we're here to dedicate our lives and our profession to a healthier Ohio and healthier population. It's a commitment from us as physicians and as the Ohio State Medical Association to educate our patients, to help them understand what are reasonable expectations, what pain medication is used for, how to use it safely, and not to slide down a slippery slope into dependency. We're offering more than lip service with this. We're asking our membership, we're asking all the physicians to go an extra mile, to use new tools, to learn more, to understand pain management. Even if we're not in pain management specifically, each one of us that deals with pain, and that's probably every physician in the state, needs to understand how to deal with that and how to help our patients deal with that and how to accept that sometimes pain management it's a climb up. It's a journey. It's not a point destination. A key component of SmartRx is the opportunity that we're providing for physicians to get little learning modules online so that we can educate the physicians in Ohio as to the proper ways of educating patients, proper ways of prescribing, proper ways of dealing with the other incidentals regarding that, you know, safety of medications, locking them up, making sure that everything is safe, and keeping them out of the hands of other people in the household. That's a very, very key component. So on that note, I think we have a short little clip as to what the SmartRx is. This is going to be to start out with, it's for education.